Our third and last presentation for this session is from Dr. Dorothy Hatsukami. Dr. Hatsukami is a PhD, is a professor in psychiatry and behavioral science, and she's the Associate Director of Cancer Prevention and Control at the University of Minnesota. Her areas of expertise include nicotine addiction and its treatment, and tobacco regulatory science, assessing toxicity and addictiveness. She has contributed to Surgeon General reports and also has served on numerous scientific advisory boards through the US and other general agencies. She is currently a member of the World Health Organization Study Group on Tobacco Product Regulation and the National Cancer Institute Board of Scientific Advisors. Dr. Hatsukami, we are ready whenever you want to start.
Does that look all right?
Yes, it looks perfect.
Okay, great. So my job was to actually talk about the science behind reducing levels of nicotine in cigarettes. Oops. Let's see. Trying to figure out how to advance my slides. It's a little bit different. Let's see. Okay. As Neil had discussed, they had proposed reducing levels of nicotine content in cigarettes as a national policy approximately 30 years ago, so really a long time. And what they had proposed is actually gradually reducing the levels of nicotine content in cigarettes to a level of about 5 milligrams per day, as he had described. Now, the research actually remained dormant during the many years after they made this particular proposal, in large part because there was no government agency that could actually implement national policy in reducing levels of nicotine content in cigarettes. But since the Tobacco Control Act that was passed in 2009 with Section 907, as described by Mitch Zeller, as well as the Framework Convention on Tobacco Control with a specific Article 9, we had government agencies having jurisdiction over tobacco products, so we can, in fact, institute tobacco product standards. So just a little bit of a history. With the Tobacco Control Act on the horizon, Mitch Zeller, who at the time that we were thinking about this was not the director of CTP, and I decided to revisit the whole idea of reducing levels of nicotine content as a policy, in large part driven by the continuum of risk of tobacco products, where cigarettes would be the most harmful, the most deadliest. And so what we did is we convened a group of tobacco control stakeholders, as well as people and representatives of government agencies, to take a look at the scientific literature to see whether this nicotine reduction approach might be feasible as a policy. Once we decided that it was a feasible policy, that there would be a lot of interest in conducting some research to support it, we crafted a research agenda. And importantly, this discussion of the need to conduct further research led the National Institute on Drug Abuse to provide experimental cigarettes that would vary in nicotine content, and they include the name of the cigarettes were Spectrum cigarettes. So what was on this research agenda? Well, the first question is, what dose of nicotine leads to reduced smoking? And so Dr. Eric Donnie led a randomized control trial where non-treatment seeking smokers were randomized to various doses of nicotine ranging from 15.8 to 0.9. Oops, not quite sure what happened there. To 15.8 to 0.4 milligrams of nicotine per gram of tobacco. And they used these products for a period of 6 weeks. And what he found is that at the dose of 2.4 milligrams of nicotine and below, you see that there's reduced smoking compared to cigarettes that had higher levels of nicotine. But it was really at the 0.4 milligrams of nicotine per gram of tobacco that you saw a decrease in cigarette dependence, as well as an increase in quit attempts during the follow-up period. I think what was also important in this study, as well as subsequent studies, was that there was no evidence of compensatory smoking, as Dr. Benowitz had alluded to. I think what's also important is the number of researchers that have looked at the effects of reducing levels of nicotine content in cigarettes among different populations. And this speaks to the whole issue of health disparities and the need for health equity that Dr. King had mentioned. So there were randomized controlled trials among youth, among those with serious mental illness, among individuals that had affective disorder, people of lower social economic status, and people who were intermittent smokers. And in all these populations, we did see a reduction in cigarette smoking. There also were secondary analyses that were conducted among African Americans and relatedly among menthol smokers, as well as substance users, including people that use cannabis and alcohol. And again, in these populations, we did see a reduction in smoking among those who were assigned to the very low nicotine content cigarettes or reduced nicotine content cigarettes. So what's also important about these studies of that is that some of these populations did reduce their levels of nicotine or reduce their levels of smoking, but they weren't as dramatic as other populations. So I think that's one of the things that we really need to pay attention to, is that some people may not, some people who smoke may not be as responsive to reduced nicotine content cigarettes. Now, the other important question that needed to be addressed is, what kind of approach do we take? Do we immediately reduce the levels of nicotine in cigarettes, or do we gradually reduce the levels of nicotine? And this, of course, what Neil had talked about is he had proposed gradually reducing levels of nicotine in cigarettes. In this study, we again took non-treatment seeking smokers and randomized them to one of three conditions. One was an immediate reduction to 0.4 milligrams of nicotine per gram of tobacco. The other conditions involved a gradual reduction in nicotine levels, and the nicotine levels were reduced on a monthly basis until we reached a 0.4 milligrams per gram dose, or a control condition where people continued to smoke normal nicotine content cigarettes. The blue shows the immediate reduction, and what you see is that those who were assigned to the immediate reduction condition experienced or had lower cigarettes per day. They also had lower exposure to toxicants, and they had greater number of smoke-free days. And again, that's shown in blue. What was of concern with the gradual reduction approach was the fact that there may be some compensatory smoking that might occur when people are shifted to the moderately lower doses of nicotine. That is, there's enough nicotine in the product that they can engage in compensatory smoking to get levels of nicotine that are more satisfying. The other concern that we had is that smokers who underwent the gradual reduction approach may adapt to the very low nicotine content cigarettes. So what we found is that those individuals that were in the gradual nicotine reduction condition, at the 0.4 milligram dose, they experienced higher levels of cigarette satisfaction compared to those individuals that were in the immediate nicotine reduction group. They experienced this higher level of satisfaction, even when we controlled for the duration of which, during which they smoked the 0.4 milligram dose of cigarettes. Now, there may be some concerns about the immediate reduction approach, though. One of them is that people do experience greater withdrawal symptoms, as you can see again in the blue color, the blue line, compared to the other two conditions, of course. We also observed a higher dropout rate, as well as higher non-combusted or non-compliance with only using steady cigarettes. So what that tells us is that some smokers may need to have other sources of nicotine. So what are some ways that we can reduce some of the unintended consequences? One of them is to provide them affordable and easily accessed pharmacological treatments. This is a study where we randomized people to very low nicotine content cigarettes alone, nicotine patch alone, or a combination of nicotine patch and very low nicotine content cigarettes. And what you see in the right-hand figure is that there is a greater reduction in withdrawal if you have the combination approach. Now, the concern too is that based upon the study that was done by Dr. Dani, there may be as many as a third of smokers who might make a quit attempt. And so we really want to make sure that smokers have access to cessation services to augment their success in quitting smoking. Now, not all smokers would want to use pharmacological treatments or smoking cessation services. And so the question is, should there be other less harmful products that smokers should migrate to? And so this is a study that we conducted where we randomized people to an experimental marketplace. So this was a study that we wanted to actually simulate a more realistic environment. So it's an experimental marketplace that kind of looked like one of the Amazon marketplaces. And smokers were assigned to either a condition that had very low nicotine content cigarettes with access to other alternative nicotine delivery systems, which included NRT, electronic cigarettes, as well as oral tobacco products such as smokeless tobacco, snus, or nicotine pouches. The other condition was the same, except for it included normal nicotine content cigarettes. So it's very low versus normal nicotine content cigarettes with access to alternative nicotine delivery systems. And what we did is we provided participants points that were worth $1, and they can exchange these points for either these products, any of these products, or they can keep the points and it would be exchanged for cash at the end of the study. So what did we find? This is the CO verified 7-day point prevalent abstinence across the different weeks of the intervention. And what you see in orange this time is that the very low nicotine content group had higher rates of cessation than the group that was assigned to the normal nicotine content cigarettes. Now, what about the different patterns of use among these groups? So what you see in the right-hand figure is the very low nicotine content group. And the blue indicates exclusive use of combusted products. And what you see is that there's greater reduction in exclusive use of combusted products in the very low nicotine content group compared to the normal nicotine content group. In addition, what you see is that there's a greater number of people that use both combusted and non-combusted products in the very low nicotine content condition initially. But then what happens is it tapers off over time to a level which is similar to what you see in the normal nicotine content condition in the left-hand figure. In addition, what you see is an increase in exclusive use of only non-combusted products among the individuals that were assigned to the very low nicotine content condition, as shown in the gray, compared to the individuals that were assigned to the normal nicotine content cigarette. The type of product that most individuals used who used the non-combusted products were predominantly electronic cigarettes. So what I've demonstrated so far is that you can push people down the continuum of risk of tobacco products by lowering the levels of nicotine in cigarettes. And the question is, do you need to pull them down the continuum? That is, do you need to make the products attractive enough, the non-combusted products attractive enough, so that they would be willing to make a complete switch over to these less harmful non-combusted products? That is, do they need to have flavors? Do they need to be of higher nicotine dose? And that is a question that currently Dr. Eric Donnie is trying to answer. Now, I think the other question is, what do we do about the illegal marketplace? This is certainly something that the cigarette manufacturers will be raising, is that if you reduce levels of nicotine in cigarettes, there's going to be this whole big illegal marketplace. People are going to be buying these illegal products. Well, certainly, I think the availability of ANDs will make it a little bit less likely to occur because they have an alternative product to go to. But I think it also points to the importance of having some aggressive measures to minimize the illegal marketplace. And that would include a strong track and trace system from growers to manufacturers to distributors to retailers. It also would include penalties imposed for any kind of infractions that involve the sale of these normal nicotine content cigarettes. These penalties should not be leveraged against consumers, though. In addition, there needs to be laboratory testing to make sure that there's, for compliance, and also a strong surveillance system. And finally, sufficient resources for strong enforcement. So what I hope to show in summary is that there is an abundance of concordant evidence that shows that reducing nicotine in cigarettes is likely to have beneficial public health impact. Unfortunately, we don't really know much about the effects of reducing selected other combusted products, primarily because we don't have those products available to us to test. But I would assume that there would be the same kind of standard that should be imposed on these other selected combusted products, especially if they have similar PK, similar toxicity, as well as similar patterns of use, which you will probably see with little cigars and cigarillos, for example. So, I think this systematic and comprehensive body of literature is what led the FDA, or at least contributed to the FDA's announcement for plans for proposed rulemaking to reduce the addictiveness of cigarettes and other selected products. And certainly, as the American Health Association has stated, this is a historical step that could save millions of lives, help millions of people quit, as well as prevent people from becoming dependent on smoke. And I just want to acknowledge the many people that contributed to the research that we conducted, and thank you for your attention.